I'm now 60 years old, and I think I need a little bit of work, and I want to tell you a little bit about myself and the treatments that I've done. As you know, I was born and raised in Miami Beach, Florida, and I've been around sun a lot. Especially during the last 10 years, I cycle almost every day, about 15 hours a week of cycling, about almost 10,000 miles a year, so I get a lot of sun exposure. About 10 years ago, when I was 50, I actually had a squamous cell carcinoma over here and multiple actinic keratoses, which are precancerous lesions on my forehead. At that time, I had a procedure called photodynamic therapy, and we'll actually show you the way I looked before and during the procedure and after the procedure. So I performed photodynamic therapy on myself twice, using a pulse dye laser for individual lesions as well as the skin cancer, using an intense pulse light on my face, a red and a blue light. And with the two treatments actually cleared the skin cancer completely, as well as all of the precancers. And I haven't had any precancerous lesions in the last 10 years. But because of all the sun exposure that I get, I have a lot of sun damage. And I have a lot of brown spots on my face that are starting to become more apparent. This is despite using what I think are pretty good skincare products, which we'll show you in a minute, and also using a product called HelioCare, which is basically an antioxidant that I take whenever I'm outdoors. So despite sunscreen and good skincare, I still have photo damage, but I have yet to have another precancerous skin lesion. Let's see what I look like on the Visia unit. So we can see on the Visia that I've got an incredible amount of sun damage. All of these little black spots are basically dystrophic or abnormal collagen fibers underneath the skin. If you look at the redness, you'll see that I also have a lot of blood vessels. The blood vessels are not rosacea. The blood vessels represent, again, extensive sun damage. Now maybe it's a little more today because I actually just did a 3-hour bike ride. And finally, even though I use a Clarisonic skin brush, you can see that I have a lot of bacteria in my oil glands, and that's what all these yellow dots are. The yellow dots are bacteria fluorescing or lighting up in my oil glands. And so I've got enlarged pores, I've got excessive numbers of blood vessels, I've got significant sun damage. And what we're going to do today is we're going to do a procedure on my face. We're going to do actually two different procedures. On one side of the face, I'm going to use a 1927 nanometer fractionated thulium laser, commonly known as the Fraxel Dual. And on the other side of my face, we're going to use a new technology called PicoWay, which is a 532 and a 1064 fractionated picosecond laser. We'll see how I look every day after the procedure, as well as during the final results. So let's get started. I'm now going to show you the skincare products that I use every day. So you can see we've got a lot of really good skincare products. One product that I use all the time is HelioCare. It's an antioxidant that you take orally, and I take 2 tablets every time I'm going outdoors on my bicycle rides. Another product I like to use a lot is the Sorlin gel, which comes in a little pump, and I use this as an antioxidant, especially around my eyes. Another product I really like a lot is the Clarisonic, which allows me, when I use it with a foaming cleanser, which I'll show you in a minute, allows me to sort of clear all my pores so that they can be as tight as possible. Even though it's not the subject of this video today, I use the NuCell for my scalp, as well as their shampoo and conditioner. Now, I don't have a lot of hair, but I've been using it for a few months, and my wife and my tall friends tell me that my hair is getting better. finally, one of my favorite products is the Skin Medica Total Defense Repair. I think this is actually the best sunscreen ever put on the market because not only does it have physical blockers, but also antioxidants. And finally, in order to try to eliminate the photo damage I have and the pigmentation, I use Lytera. So those are the products that I use personally. So because I don't want to feel any pain, and I don't want my patients to feel any pain, what we do is Jacob, my medical assistant, is going to put on a numbing cream. So Jacob, put it on thick, buddy. Now the numbing cream usually stays on for about a half an hour, and your face feels a little tingly. And this will make the laser procedure almost painless. So see, when your physician asks you, is it painful? It's always good to ask the physician, have you had this procedure before? In this office, most of us have. While Jacob's putting this on, the only other interesting information about my face is people always ask, well, I'm 60 years old, what have I done? As I've mentioned before, we did that procedure called photodynamic therapy that treated my cancer and precancerous lesions. I really haven't done anything else. About 3 or 4 times in the last 10 years, I've been a demo patient for my colleagues injecting me with either Botox, Dysport, or Xeomin. And I have had fillers performed, especially on my nasal labial grooves, again as a demonstration patient once or twice in the last 10 years. Finally, I had an experimental treatment done to treat my scars, the one on my left cheek, and some of the wrinkles around my eyes. And that's about the only thing I've done to myself ever. So people always ask, well, how do you minimize and prevent aging? Well, the only way to prevent aging is to not be alive. So we're all going to age. But I think there's 3 important factors. One, of course, is genetics. If your parents look good, that means you're going to have a pretty good shot at looking good. The second, and most important, I think, is happiness. If you're really happy, you're going to look better, decrease stress. And then finally, it's exercise. The more aerobic exercise you do, the more your heart is pumping blood throughout your skin, and that also, I believe, improves or makes it a little anti-aging. Then, of course, there's nutrition that comes into play, but I think the 3 most important factors are genetic, happiness, and exercise. So I've now had the topical anesthetic on my face for about 30 minutes and it feels really numb and tingly, almost like it fell asleep. And I have my favorite new associate, former fellow Dr. Douglas Wu. He's the guy I trust to do my face. So Dr. Wu's going to treat me.
Okay, so we're ready to go here. This is the Fraxel Laser, and we're going to treat Dr. Goldman here. One half of his face is actually going to get this laser, and the other half is going to get a mystery surprise laser, but the end result is going to be amazing.
So this is the first time I've ever been treated with this laser, and it's virtually painless. So 1, if a guy can handle it, and 2, if a doctor can handle it, you know this is a piece of cake. Every now and then you might feel like a little teeny, what feels like a needle stick, which is the laser, but nothing bad at all. So again, all you feel is, you feel like the cold air, which really isn't bothersome at all. Every now and then you feel like a little teeny sting, but really nothing bad at all. It's interesting, the forehead you feel a little bit more, but still very tolerable.
Okey doke. Well, we can move to the next laser.
So it's so easy, you can actually do it yourself. See, look at that. Okay, but don't do this at home. As you can see, I just had this part of my face and the entire forehead treated with the 1927 fractionated laser, the Fraxel Dual. It's a little bit redder. There's absolutely no pain whatsoever. So that's the good news. A few little needle sticks during the treatment, very tolerable, no post-treatment pain. So I'm now being treated with the PicoWay, which is a fractionated laser system, which is a holographic fractionated system, which is very interesting. When I compare it to the 1927 Thulium, it's even less painful. You hardly feel anything. Again, maybe a few little teeny needle stings here and there, but really, for a guy and a doctor, virtually painless. On a scale of 1 to 10, with 10 being horrible pain and 1 being almost nothing, this is a 1, and the other laser was maybe a 1.5 to 2.
So we're going to switch out the handpiece here. This was a 1064 handpiece. We're going to switch to a 532 handpiece to get a different depth of treatment. So it's a very easy process. I'm going to do 2 passes with this, and then we'll pass it off. Off the bolts.
So with the PicoWay, with 2 different wavelengths, the 1064 is more like laser toning to stimulate collagen production. The 532 is for mostly epidermal pigmentation that goes more superficially. So that's the advantage of this laser. The advantage of the Thulium 1927 is it's basically just superficial pigmentation. On this 532 fractionated laser with the PicoWay, again, you don't feel virtually any pain whatsoever. So a very comfortable treatment. So this side of the face was treated with the 532 and 1064 fractionated PicoWay. This side of the face was treated with the 1927 Thulium Fraxel Dual. What we're going to do is over the next 7 days, and even longer, we're going to see if there's any difference between the two, which one actually works better, and if I can perhaps become a little less photo damaged. So let's wait till tomorrow.